My name is Marianna Fontana. I am a professor of cardiology at University College London, and I work at the National Medicine Center as a cardiologist. For me, as a cardiologist, working with patients with ATTR amyloidosis, but working in general in cardiovascular medicines, there are several points that we need to think about when we think about the importance of the study. So first, was the first time that CRISPR-Cas9 based technology was ever used in any cardiomyopathy. So this is, I think, an important milestone for the field of cardiology. So this is a proof of concept that can be used, and a single infusion can be used in this specific field to treat patients with ATTR cardiomyopathy. So it's extremely important for the future of ATTR cardiomyopathy because this one was the phase 1 study showing the effectiveness that is extremely effective and safe, and a single infusion leads to deep, sustained, and durable reduction in the serum TTR level, and this is associated with favorable clinical outcome. But at the same time, I think it's got implication for the wider field because the proof of concept that the cardiomyopathies can be treated with CRISPR-based Cas9 technologies. I mean, the very unique element of this product is that with a single infusion, we can permanently edit the DNA of the liver cells. And so this treatment is just one-off infusion for the rest of a patient's life. So this one for me is really the unique element of these. And this was an important step, not just in the field of ATTR cardiomyopathy, but was the first time that CRISPR-Cas9 was used to edit the genome in any cardiomyopathy. So it was really a milestone step for cardiology. So this study included 36 patients with ATTR cardiomyopathy, hereditary or wild type. So this was a phase 1 ongoing open-label single-arm study where every patient received treatment. There was a part 1 study which was dose escalation and a part 2 where there was dose expansion that all the patients received a fixed dose. And the primary objective of the study were to assess the safety and tolerability and PD, so the TTR levels. And the second objectives of the studies were to assess blood biomarkers, so NT-proBNP and troponin, functional capacity with cardiac pulmonary exercise test and 6-minute walking test, KCCQ, and then various parameters assessed on cardiac imaging, i.e. cardiac MRI and echocardiography. I mean, what we found is that after a single infusion nex-z, we saw a very deep and sustained and durable reduction in the TTR levels, reaching a percentage reduction at 28 days of 89%. So a very rapid reduction. And but importantly also, the levels were sustained over time. So throughout the 24 months of observation, we saw that the levels were unchanged. So there was a rapid reduction at 88-89%. This was very deep, and they were the same in every single patient. So there was not lots of variability. And then they were sustained over time. And so what we saw is that this deep, durable, and sustained reduction translated in stability or improvement in some of the patients across a wide range of markers of disease progression that we used for the study. So we used the established threshold for the NT-proBNP, the troponin, the 6-minute walking test, and what we saw is actually the patients were stable or improvement. And this was in spite the patient population being a very severe patient population. I mean, there was 50% of the patients were NYHA functional class 3. There was a high proportion of RN patients, 2 of which were homozygous, so a very aggressive form of disease. The peak oxygen uptake was extremely low, so functional capacity severely reduced, 12.7 milliliters per kilo per minute. And also the NT-proBNP was a median of 2,000, but went up to 20,000. So in spite of the patient's population being extremely severe, the patient remained stable and some of them improved. So it was an extremely remarkable study. The field is very exciting. I mean, a CRISPR-Cas9 gene editing approach is a module that can be used for any gene in the genome because you can basically produce a guide for the various genes and then you can target the various genes. So the potential for the future for CRISPR-Cas9 is really incredible. And in ATTR cardiomyopathy, the future is that there is already an ongoing phase 3 study, the MONKey-2 study, which assesses the efficacy and safety of nex-z in a large population of patients with ATTR cardiomyopathy. And so the study is a classical double-blind, randomized, multicenter, placebo-controlled trial and uses hard outcome as the endpoint.